Good evening, everybody. Dr. Carmen Bryant, Psychological Health Consultants and Services, and this is my channel, Redefining Yourself. This is a program that was developed for women in mind, women that are thinking of leaving, or have left and are recovering from domestic violence. My specific topic of interest is narcissist abuse, so it's overcoming narcissist abuse. For those of you that are new to my channel, thank you guys so much for subscribing to my channel. Thank you guys so much for the comments, the wonderful comments, a lot of information you guys are providing, a lot of feedback you guys are providing. People are reading it, people are loving what you're saying as well, and I'm loving it because you guys are actually talking to me and I'm talking back, and so I really enjoy it. Thank you guys so much. You make me think. And even the questions that you guys are asking. So if you have not already, please subscribe to my channel. It is Dr. Carmen Bryant with a T, Overcoming Narcissist Abuse. And please hit the bell to go along with that so you know whenever I upload another video. I also have a professional Facebook page, which is Psychological Health Consultants and Services. You're welcome to like the page. Normally I go live on the weekend. Usually I try to do it on a Sunday. And I go live so we can do some question and answers. We can chit chat a little bit, talk about what you've learned, and so I usually go live on both channels. However, there will be time to time when I am traveling, I may not be able to come but on one channel, so I encourage you to go and subscribe to the YouTube channel because I'll only be able to go off of one or the other because I won't be in the convenience of an office to hold two cameras at the same time. And so once again, I thank you guys so much for following me. Thank you guys so much for subscribing to my channel. Thank you guys for all the comments you guys are making. And so I know tonight is a little late, so I don't know when you're going to get the video, but I still want to come on really quickly. I'm not going to stay on long tonight because I have to leave the office. But I had a full caseload today, and so I wanted to come on before I left the office. I wanted to talk to you guys a little bit just to answer some questions. So I had three questions. Two of them I'm going to answer this evening. The other one I'm going to make a video on next week because I think that one's going to be a little lengthier. But one of the questions was from Rocker Girl, and I asked her if I could, make a video and I'll talk about it. And Rocker Girl, it's how do they know this? The information. I think there's a narcissist abuse in your five senses, the video I did yesterday. But the question is how do they know this? Are they doctors? And they must really be smart to be able to do this to people. So let me teach you something. First of all, not all narcissists are smart. You make them smart. Because remember, a narcissist mirrors you. So they watch everything that you do. They mirror everything that you say. They watch your hand gestures. They study you before they actually come and interact with you. You could be a doctor, you could be a lawyer, you could be, whatever, but they study you, they listen to you, and a lot of times you tell them information. You make them smart. That's what you do. You make them smart, they listen to you. The videos that I make, I break down specific things, like, for example, when I was talking about the five senses. I am a trauma professional, and so as a trauma professional, I learned certain things about trauma, how trauma happens, where is it stored in the limbic system, and the different parts of the brain, the different parts, because I have to work with people that have been traumatized. So I break down things that I've learned to you, and I try to simplify it to help you understand how people have processed trauma, how I'm a mental health professional, and so I study people's behavior. I study what they say. I study facial features. Prior to becoming a therapist, though, and for many people that are gifted in something, for example, people that are really gifted in art, 9 times out of 10 you could trace it back to their childhood, or you watch them, they were gifted in drawing, or and then that was cultivated. That gift was cultivated to make them a great painter, a great artist, whatever. Doctors, may have been good. They like to dissect things. They were interested. Their mind was just focused on doing things in the medical field. Therapist, a lot of times you were the type person that people just came and talked to, and you were really good at problem solving. You were good at certain things, so people have different gifts that they cultivate. A narcissist, they don't think in terms of, oh, I'm going to use the five senses to do this, or, oh, I'm going to do this. What happens is it's learned behavior. And I did the trauma bonding. If you go back and watch trauma bonding, it tells you how they condition people. And there's another one I talked about, the classical conditioning and the conditioning, if you remember the Pavlov theory of the salivating dog. they realize like, hey, we're going to put this dog, tie this dog up, and we're going to ring a bell. And when we ring a bell, we're going to bring the dog food. And so they rang the bell, they brought the dog food, the dog salivated. They kept doing this until eventually they took away the food, they rang the bell, and the dog salivated with the expectations of receiving food. So it's classical conditioning. And they discovered that when they were doing these experiments, okay? Well, a narcissist is not studying a person. They watch, they're reactive. So they watch to see how you respond, those subtle facial expressions. They watch everything that you do, and they collect that information. Each person that they go to, or each supply that they get, they watch what they do, and they practice whatever they learn from you. They're going to practice on the new supply, and they're going to enhance what they're doing. They're looking for those subtle expressions. They're looking to see how you respond. Remember, they're always looking for fuel. Your facial expression is a fuel. If they say something, you look at them like, that is fuel. So they're watching those subtle facial expressions, or what ticks you off, what makes you fly into a rage, what makes you argue back with them. Things like people, if they've discarded you and they go with someone else, and they want to make sure that they're posting pictures, they know that you're triggered by that. So they know you're triggered by that. You're probably going to respond to that. You may say something to them until you learn to gray rock and not have emotions associated or affiliated. When you go no contact and gray rock, you have no emotions or anything to provide them with fuel. Remember the snake? A snake doesn't have vision like we have vision. They have to look for heat sensory, and their tongue, can taste things in the air. Well, a narcissist does not function off of the knowledge of knowing this is how the five senses work. They operate off of classical conditioning. They do certain things and you respond a certain way, so they keep doing the same thing over and over again, right? So it's not that they're smart, is that you're training them how you are going to be treated. That's why when I talk to ladies, I tell them, when you start dating, you're training the guy on how you want to be treated, and how you want to be treated, and how you want to be handled. And if you don't put any boundaries or standards, same thing with the gentleman. If you don't put boundaries or standards or any limitations, then a person will just continue going as far as you let them go. Well, a narcissist is like that. So it's not the fact that they're really, really smart in the doctors and they study human behavior, or they go to school to learn these things. They watch your behavior. You are their greatest trainer. Each supply is their greatest trainer, and they learn something new with each supply. 9 times out of 10, if you have been discarded a narcissist, the supply that they're with, they have conformed to and taken their characteristics, mirrored them, mimicked them, and they don't have their own self-identity. They mimic and mock and parrot, and they conform to this new source of supply. So you don't recognize that narcissist. You're like, that's not how that person was when they were with me. No, because they have conformed to a new source of supply. And they learn from each source of supply, and they go up levels, and they learn. Just like a therapist. When we sit in therapy, a therapist learns things. Those people that are in the world of clinical work or psychology, psychiatry, when you're in school, you have book knowledge. You don't know what it looks like in actuality. You don't know what it looks like. So we do things like a practicum. So practicum, you go work somewhere and you look to see, okay, this is the diagnosis. These are, when you look into the DSM, the features of a disorder has characteristics. For example, schizophrenics. Those people that have schizophrenia, they have similar characteristics, they have similar symptoms, and then being in a practicum, and if you're in a practicum where you get to see the more severe mental health, or then later on after you graduate, before you get your license, most state boards want you to at least have, well, in the state of Washington, 3,000 hours of hands-on work, well, 3,000 hours in general, but hands-on, face-to-face, so you can see what these diagnoses look like. For example, with schizophrenia, they have common themes of thought insertion, the radioactivity in the brain, the radio frequency, different voices telling them that there's a higher power, and that they're of a higher power, and that, so they all have similar themes. They have similar symptoms, and it's grouped together. So as a therapist gets comfortable in their profession and they see it oftentimes more than not, even what does depression look like? How long does that, what kind of symptoms do they have? So instead of us looking at a piece of paper, we now know how to ask. You give us certain information, we know, okay, this is grouped over to these type of symptoms. So this sounds like major depressive disorder. Okay, this right here sounds like, we know what questions to ask. This right here sounds like schizophrenia. This sounds like schizoaffective, which is a cross between bipolar and schizophrenia. It's like, two of those put together. But we learn by experience and we watch, and the more seasoned clinicians, it's easier for them to pick up on certain things. What's the difference between ADHD, complex PTSD, or bipolar disorder? All three of those look very similar. How can you tell those apart? Well, one is one deals with concentration, chemical imbalance, or one deals with chemical imbalance, one deals with trauma, so we learn and we watch people, oh, this is how they act, or this is what happens. Oh, what does it look like when they have a manic episodes, or what are some of the common symptoms or common themes that are within. So think about it. If we as clinicians are sitting in and we're watching body posture, the communication is nonverbal. So we're watching body posture, we're watching facial expressions, we ask questions. A lot of times as we're probing, and especially as a trauma professional, as you're probing and trying to find out what's going on in a person's life, we're watching for subtle cues, subtle nonverbal cues, subtle facial expressions to know, okay, I've hit a spot, let me continue going with this so I can get to. Well, narcissists do the same thing. They're not taught by book knowledge. They're not taught, but even a narcissist, you look, they all have similar characteristics and symptomology. If you look in the DSM, they do the exact same thing. Each person is an individual person, just like with children with Down syndrome. If it doesn't matter what race, what color, what creed, it doesn't matter. You go across the country, and if you have a whole lot of children of different races, different cultures, different languages, they all have similar facial features. Children that are autistic, on the autistic spectrum, they all have similar features. So if that's the case, narcissists all have similar features and symptomologies that qualify them to receive a diagnosis of narcissistic personality disorder. Now, for the narcissist, it's not that they go to school to learn this. You teach them. You teach them certain things. They learn from you. They learn things from you. For example, with a particular sex partner, they have sex a particular way. So they meet a new source of supply, they'll take that information, and then they're taught something new and they apply it to that information, and then they meet someone new and they apply it to that information. So now in your mind, when you meet that individual, this individual knows everything within us. Those somatic narcissists, they know, and they're great sex partners. They're not great sex partners, they just have collected a lot of information to put together to apply on you, and now you're going to teach them something new. So it's not that they're super smart. Some of them are crafty. A lot of them they're all manipulative, crafty, but they all have gathered some information for their repertoire. And so, and they watch facial features, all that stuff that we learned in school. Some of that stuff we didn't know. We were just people watchers, like sitting in the mall watching people. And then when you get into school, they group it into information. You're like, I never knew that's what that was. I've always done this, or I've always people watched, or I didn't know that, So now you're getting information to put together to understand the art of therapy. Well, narcissists, they don't get a degree in what they're doing. They get degrees of narcissism, but they just watch people and they manipulate people, and they see how you respond, and they just add to their repertoire of information, or their toolbox of information. So when I make these videos, I break down certain information so that you have the knowledge of what is going on. You got to remember, narcissists, they pick on everything that you train them. You're the greatest trainer. So a lot of narcissists are not very smart. They're just duplicating, replicating, mimicking, and mirroring what they see and what you're doing. And so they're learning from you. That's what they're doing. I'm just providing you with information and breaking it down. So so it sounds, like, oh my gosh, I can't believe that they're that smart. Not all of them are that smart. A lot of them are very manipulative and very experienced. They've been doing this for a long time. There's a difference between an intern that comes in to do therapy and a person that's been doing therapy for a long period of time. The long period of the seasoned therapist has to teach the intern what certain things look like. So it makes the more seasoned therapist look really, oh my gosh, this is really amazing. How do you know all this? Because 9 times out of 10, that seasoned therapist has sat in and watched it happen so many times, the more severe cases, and these are the severe, you see? So narcissist does observation too. So hopefully, Rocker Girl, this answered your question. Okay, so let me scroll up. Let me know if this answered your question, okay? And did it make sense? I just wanted to read Miss Terry King. Thank you for joining me on YouTube. One of the comments that she makes, which I really like, and I'm going to use that, narcissists counterparent. They do not care what is best for the child or anyone else. So they don't, that's a really good word. They don't co-parent, they counterparent. You are absolutely correct. Excellent choice of words. Let's see. There's a question. Okay. And so I had a subscriber send me an email, and I asked if it was okay to read the comment without disclosing her identity, and she said it was okay. And what she said is that she was in a same-sex relationship with a female for 7 years. She's been out for 2 years, and now she feels stuck. She has not truly experienced the anger stage, and asked me if I would elaborate on anger for the video. So first of all, as I said in any of the other videos, narcissist abuse and narcissism has no race, has no religion, has no sexual preference. It is blind. It is a equal opportunity discriminator and abuser. So you see, it doesn't matter whether you're in a same-sex relationship or in a heterosexual relationship. Narcissist abuse and narcissism is exactly what it is, and people experience it across the board. When I say, and that's in, and I don't care what color you are, it doesn't matter. Narcissist abuse is narcissist abuse. The next thing is that you've been out of it for 2 years. So you were in for 7 years. So if you've been in a relationship, an abusive, narcissistic relationship for 7 years, imagine it takes time to heal from that. And when people come out of abusive relationship, especially a narcissist, that is, you know, and I tell people this, and my mentor has said the same thing. When you're coming out of a domestic violent relationship, a lot of times you can go to counselors that understand domestic violence, the dynamics of the power and control wheel and domestic violence in general. But when you're coming out of a relationship with a narcissist, that's a whole different level of abuse. You really need to find a therapist that understands narcissist abuse, narcissism, and the effects of narcissist abuse. You need to ask questions, number one, because that is a totally different type of healing, a totally type of different dynamic and abuse that a person goes through. And so 7 years being in a relationship with a narcissist, it's only been 2 years. You're still going through your grief and loss process. Just like people that have lost loved ones, you go through a grief and loss process. And everybody does not go through the stages of grief the same way. You have the initial shock, you have the denial, you have the anger, you have the, negotiating, you have the depression, you have the hopelessness. There's different things within the grief and loss process you go through. And some people, you may be in that shock, you're angry and don't realize you're angry, or you're so hurt that you have not had the opportunity to really express your anger. The one thing that I do, the anger may come. And a lot of times you kind of condemn your own self for how can I have been this stupid to get into a relationship. It's not the fact that you're stupid. It's just that they're good at what they do. They know how to pull you in, and there is some hurts. There are some holes in your heart. There's some stuff that they were able to put their claws in and pull you. They played with your vulnerabilities. They played with your heartstrings, and they pulled you in. And so even though you may be stuck right now, you are probably stuck in one of the stages of grief. Normally when I have people come in to counseling that are struggling with, with grief and loss, and it could have been years ago that they have struggled with, losing a loved one or a breakup of a marriage or a relationship. A lot of times what I have to do is I give them a handout of the grief and loss process. I do the 7 stages of grief and loss, instead of the 5, but I do the 7 stages, and I have them read. 9 times out of 10, they're probably stuck in one of the stages. And so to my subscriber that emailed me, you may be stuck in one of the grief and loss stages. One of those stages you're stuck in. And so what you have to do is I encourage you to go to a grief and loss counselor. Ask them if they understand the grief and loss associated with narcissist abuse. Shop around to find someone that you feel like understands what you've been through, because that's a totally different type of breakup and a totally different type of domestic violence, totally at a different level. And you may be stuck in one of those grief stages. And so it's good to be able to process. Ladies and gentlemen, when you're going through a grief and loss process, don't stop the process. Go through the process. Feel the process. Feel the emotions. Feel the pain. Feel the heartache. Feel the anger. This is a very normal process you're going through after, loss. If you don't process all the way through, you're liable to repeat it. But when you process through all those stages, it makes you a little more sensitive to, I'm not going to jump into a relationship that quick because I know what I've been through. People jumping out of grief and loss and jumping right back into a relationship, it is really bad for the process, because you really didn't go through the stages and feel it, understand it, process it. You're probably just stuck in one of the stages. I'm going to call you Miss Anonymous. There you go. Miss Anonymous. There we go. Keep your name anonymous. So Miss Anonymous, there we go. You're probably stuck in one of the stages of grief. And so if you're stuck in one of the stages of grief, I encourage you to find a grief and loss counselor. You can try and see if you can go to a grief and loss counselor to see if they, how does it feel just talking about grief and loss and being stuck in one of the stages of grief. If it's not to your satisfaction, then you may want to ask and see if you can find one that understands narcissist abuse and recovery, depending on, how bad this situation was. If it was a pretty bad situation, you might want to get to someone that understands narcissist abuse and recovery. So hopefully, Miss Anonymous, hopefully this answers your question, okay? Let's see if there was any more questions. Let me look. I know there was another question. Let me find it. Let me look. Let me see what the question is. Let's see here. Hopefully I did not. Oh, here it is. So The Beauty Within, she said, love your videos. Thank you so much. I'm honored. I do it for you guys. You have been instrumental in my journey to healing. I am so honored. I am so glad. Could you do a video on narc and pregnancy, using it as a means to trap a man or woman to gain control? I've even had experience with the narc who used pregnancy as a way to see how far the woman will go, him wanting to push his opinion on them having an abortion. The moment they went with it, he figured he won them over. Just wanted to hear your thoughts. Okay, I can address that on this video. Okay, so first of all, understand this one thing. Narcissists see everything and everyone as a source of supply. Marriage is not marriage the way that you see it, but if it's valuable to you, they'll use it to hook you and hold you in. So marriage is not, a monogamous relationship between the two of you and you see your future, and, they do the future faking. This is all the things that I want to do. I want to do for you what I've never done for anybody else and no one else appreciate it. I want to be able to buy you this and do this, and I want to treat you like this. And, my ex girlfriend or whomever, ex-boyfriend didn't appreciate this, so I want to do this, so that you see how much I care, because I finally found the one that makes me happy, and blase, blase, blah, blah. Okay, that's what they say, all that good stuff. So if you value marriage, then what they'll do is use marriage, because you probably already talked too much and told them, they'll use marriage to hook you and to get you in, to lock you down. Now, depending on, they use pregnancies, they use children as sources of supply to get attention to themselves. They try to create this perfect little illusion, to people, look what I got. And they usually go after people that most people can't get. So they try really hard, and they're stalkers. So they go after people that for most people is hard to get, to show that, it really feeds their grandiosity, it fuels them. So to have a baby with someone, you might be a very good source of supply, whether it's money, material possessions. So they'll try to lock you down with pregnancy, whether female or male. Try to lock you down with pregnancy to hold on to you, so you're locked to them for life. Think about it. When you have a child with a narcissist, it requires, and I know Miss Terry said, counter parenting. So it requires co-parenting. So really you're going to deal with counter parenting. But they look at it as, you're mine for the rest of your life. Even if you leave me or divorce me, you're mine for the rest of your life, because now we have this little source of supply, this fuel. When they parent, or when they parent a child, they're not really parenting. What they're doing is that is another extension of themselves, because they know that they can get attention for this little baby or this little child. And especially if this child is productive in what they do, very cute baby, whatever, I dress them like me. But they're gonna now get attention from people because of the baby. You're such a great mother. Oh my gosh, he is a great father, and I've never seen anybody father a child this way you are. But that's fuel. They're feeding that fuel, so that child serves a purpose. The child is just an instrument or a supply or appliance, but they're feeding on, because you're feeding them this. So pregnancy, and marriage, this is all to lock in that supply, because that was valuable to you. So they use what was valuable as a means to lock you into this relationship. Number two, yes, there are times where they want to see how much control they have. Have they locked you down enough where you'll do anything? They have enough control of you that you'll do anything that they say. So if they say, I want an abortion, you're like, okay, then yes, they know I have full control. I have control. That's what they want. They want control. They want control. They want to literally possess you. They want to be your God. You follow everything that they say. There is no opinion right but theirs. So it doesn't matter what. Everything is a potential supply with fuel. And that right there, marriage and pregnancy, that's just another means of locking power and control and locking a person in. Just like sex. Sex is another means of control to lock in a person. And it means nothing to them. The only thing that matters to them is them. They are the most important thing. There's nothing valuable about you. The only thing that's valuable is what you supply for them, what you give them. Attention, adoration, good sex to you, a home, finances, an image. You've taken them from one level of income to another level of income, but everything is about the narcissist, to include a pregnancy, to lock you in for life, because they're not going to let you go. Even when they discard you, they'll always be able to come back to you for some reason or another. And when you have a child, that's easy access to you. So hopefully this has helped. Hopefully I answered the question, Miss Beauty Within. Hopefully that answered the question. Let me know if that answered the question. And I'm getting ready to go. I just wanted to come in really briefly. Thank you guys so much for subscribing. Thank you for all the questions. Thank you guys for following me and your support. If you have not already subscribed to my channel is Dr. Carmen Bryant, Overcoming Narcissist Abuse. Hit the subscribe button and the bell, so that you can be alerted whenever I come and post new videos, or whenever I come on live. I usually come on live on the weekends. If you like to, you can also go to my professional Facebook page, which is Psychological Health Consultants and Services. Hit the like button so that you can be alerted whenever I come on or whenever I post. I post the videos in both of those. And thank you guys so much for your support. Email, if you'd like to email me, my email address is drcarmenbryant, drcarmenbryant @outlook.com. You're welcome to email me questions. If you would like to remain anonymous and you would like to send me questions, just let me know if this is okay to read. Is the question okay to read over the air? Do you want to remain anonymous? And just ask the question, and then I will answer the question. Thank you guys for the questions too. Some of you guys do understand this, that some of the questions that you ask, when I read them over the air, or when I do the recordings, someone may have wanted to ask that question, but you might be asking a question that someone else didn't think to answer. So a lot of the answers may be something that someone was looking for. So thank you guys once again, and as I always say, go and be great, and you guys have an awesome weekend.